I'm Dr. Jose Parra. I'm a vascular surgeon working for Maryland Vascular Specialists. Basically, we're experts in the outpatient treatment of leg pain. Specifically, we address different vascular causes of leg pain, and that takes the form of artery problems and vein problems. So, for instance, if you have a blockage in an artery in your leg, you're going to get cramps when you walk. And that's where I come in. I can fix that. And it used to be, really 5-10 years ago, that would require surgery in the hospital. No longer. We can do that as an outpatient entirely. If you also have pain in your legs due to vein problems, for an example, varicose veins, that's another condition that we treat. An outpatient center, and we're actually one of the first to develop outpatient centers in this region, is a place where you can go outside of the hospital. There's several different reasons for choosing an outpatient center. Number one, first and foremost, is patient safety. When you come to our outpatient center, you're going to be assigned one nurse who will be with you from the moment you come into this center to the moment you leave. And that limits the chances of there ever being any kind of confusion. In addition, we have a very small staff that's dedicated for vascular problems and vascular problems alone. So there are experts at this area of intervention. Secondly is cost. You may not know it, but if you have a procedure done in the hospital, you're going to receive a bill from the hospital, a bill from me, and perhaps also a bill from an anesthesiologist. By moving this to an outpatient setting, you're only going to receive one bill, and usually that's going to be at a significantly reduced amount of money. And finally, there's ease. We're an outpatient center. We have great parking. There's no wandering around hospitals for hours. There's no showing up hours earlier and going here and there. You come right on in. We have a state-of-the-art, welcoming environment. I've dealt with a lot of patients who have had procedures both in the inpatient and outpatient, and 100% of them would prefer to have a procedure in our outpatient setting. Everyone gets cramps. People get cramps at night. Certainly if you're out cutting the lawn on a hot day, you can get cramps. And you can also get cramps due to serious vascular problems. I think that the key thing to think about with vascular cramps is that they occur all the time. Let's say every time you're walking around the mall, you get cramping in the back of your calves. That would be something that would be very consistent with arterial insufficiency. It can be potentially limb-threatening. If you're experiencing that, you probably want to see a vascular surgeon. There's a lot of non-invasive tests, very simple tests that we can do to determine whether you have a vascular problem that needs to be addressed. A vascular ultrasound is a very simple thing. You get a little bit of jelly on the extremity. They use a non-invasive probe to look in there and use sound to obtain an image of your blood vessels. And it's actually a very, very good and very accurate way to diagnose and determine whether you have vascular disease. Well, certainly pain in your legs overall, and not all pain in your legs is due to vascular, but you should definitely see a vascular specialist initially, because those are the most critical things. And sometimes people can have such compromised lack of blood supply that your legs are in danger. You can develop gangrene and you can end up requiring an amputation at some point. So certainly the first place you always want to start is with your vascular specialist to make sure that it's not a more critical limb-threatening problem.